All right, I'd like to welcome everybody today to Benton-Franklin Health District meeting. Today is Wednesday, January 15th. We will move through the agenda. If we can get approval of December 18th, 2024 regular board meeting minutes.
I'll move approval, Mr. Chairman.
I'll second. Motion is second. All in favor, say aye.
Aye.
Aye. Any opposed? All right, thank you. Moving on to public comment. I don't see anybody here. No one's here. Anybody online?
If you'd like to make a public comment, you can raise your hand in the Zoom app, or you can press *9 on your phone to raise your hand.
Not seeing any hands raised. Okay. All right, we'll close public comment. Senior staff comments, any?
You're in Hunter Seattle, and I have not for you.
Right along. All right. Let's go on with new business. Health officer update.
Good afternoon, everyone. Hope the holidays treated you all well. I'm gonna share my screen real fast. Just got a couple slides. This one. Right, there we go. Okay. Well, hopefully that's all working. All right. So just a couple things to talk about. And obviously I'm available for any questions. It's really interesting. Since we last talked, I think I touched on respiratory illnesses, and we had started to see RSV and influenza creep up a little bit of activity, but it was still at a fairly low level. That changed very rapidly over the last 4 or 5 weeks.
Yep.
So just looking at our data, this is inpatient, so hospitalizations. No, sorry, I apologize. That's later. Emergency department first. So emergency department visits with influenza and RSV. Looking at the last 2 years, so comparing our 2 counties and Washington in red, we're in the blue. So influenza, we had a spike. Basically, we peaked about, I want to say about a week ago, maybe a little over a week ago, and then we've been on our way down. So this darker line is our current activity. A higher emergency department visitation for influenza than we saw last year by a little bit, as well as just higher rate compared to Washington. RSV has been slightly better this year, as in slightly less hospitalizations or less emergency department visits. I apologize, I keep saying hospitalizations. So we're looking, this number is like percent of patients. Again, just to remind people, RSV, we're especially concerned about infants, especially under 6 months or premature babies. Those are highest risk. I will note we've had immunizations available for RSV for pregnant women and young children for about 1.5 years, 2 years. And nationally, we've seen rates of those hospitalizations and visits in the emergency department go down, which I think is great. Okay. This is just looking at influenza across the state. And I like this because it's the last few years. And again, just kind of darker green is this year's season, or this season, I should say. It goes into last year. We'll kind of see similar data. We've peaked and we're starting to see a little bit of a decline. Slightly more than last year, which is the light green, and not nearly as bad as a couple years ago. Blue, we had a really bad flu season. Flu varies kind of from year to year. Okay, COVID-19, I also touched on last time. We remain at a pretty low level. And it's kind of interesting, at least to me, because we usually see, we've kind of grown accustomed to these little spikes during winter and summer. At least in Washington, we're not seeing, as well as locally, we're not seeing a significant spike in activity. There's still, COVID-19 going around, and nationally there are other regions that have higher, that are seeing a kind of an increase in COVID-19. We haven't really seen that happen in our 2 counties or in Washington, but we'll kind of see if we follow some of those other regions across the country. We had, it's always interesting because we don't have a lot of data to pull on, right? We have, seasons and seasons of influenza to look at the past on to try to predict. We only have a few years of COVID-19 data, and it continues to kind of rapidly change. So interesting to see where that goes over time. Okay, here's our inpatient diagnoses, and our epi team has combined all three of these diagnoses over the last 3 seasons, with the blue line here being this current year. And again, this is inpatient, so people having to be hospitalized. Previously, we had been talking about emergency department visits, but not necessarily people that had to be hospitalized. These are people that had to, go into the hospital. And we're actually doing better the last couple of years, which is interesting. We had a slightly worse flu season this year overall. I think this is honestly being driven by lower COVID-19 hospitalization rates, which I think is great because we're combining them all in this number. When you look at emergency department visits, it's overall pretty similar to last year. Okay. Oh, wow. I went through those quick. Last slide. Continues to be a lot of interest in HPAI, bird flu nationally. We obviously had our own outbreak in our district, and some of the people from the CDC, as well as other researchers, used some of our data and published in the New England Journal of Medicine. So I thought that was interesting. One of our epidemiologists pointed out that we made up about 25% of the cases across the country that were listed in this article, which is basically all the cases that happened last year. Almost all the cases that happened last year. So just interesting, kind of our work being highlighted. There was a death in Louisiana. Someone that we think was exposed via backyard poultry. And this was our first death from bird flu in the United States. It did cause severe illness in a Canadian teenager. But generally, we haven't had severe cases of bird flu. And our experiences, again, we had very mild, people were not very sick. And that's been the case kind of across the country until this case in Louisiana. It doesn't necessarily mean, things are worsening. This patient, they kind of analyzed the genes of that virus, and seems like it had mutated inside this person to just cause more severe illness. So again, kind of just to be aware that, bird flu can be a severe illness. For our public, it's being cautious around, dead birds if they see any, having good, hygiene with backyard poultry, that sort of thing, avoiding eating, raw meat, raw milk. Those are all concerns for exposure right now. And I can't remember if Carla's going to talk about this at all, or someone from our senior staff, but because I don't know the details, but I do know that we worked closely with the CDC during our bird flu outbreak, and they appreciated our work. And I think that there's apparently some funding available that may pay for some of the extra work that we had to do during that, which I think is just a really nice kind of recognition of all the hard work that our team did during that response. So yeah, that's my update for today. I'm happy to answer any questions.
No, I think I think the update is pretty accurate from what you're saying. I know that the first 2 weeks of December, I know I was one of the ones that did catch COVID, and I think people aren't going to the doctor. I don't know if COVID is as severe this time around or not, but I felt it was like a head cold until probably one day I went hard physically on working out, and that kind of knocked me down. But other than that, I never went to the doctor, so it's kind of hard to find out how many people actually go to report it. And then right after that, my daughter came from University of Tennessee to law school and decided she wanted to give me influenza A, or share that with me.
Oh no.
So back to back. So that was probably,
geez.
mid-December for the last week of December. And I've talked to a lot of our friends and a lot of families have been down the last week, 2 weeks with influenza. And I know there's two different types. I did not know that. I had to read a little bit about that because I did go to the doctor for that one, urgent care along with my daughter since she did, and it was influenza A. And so I don't know if there was more influenza A going around, if there's more influenza B, but I heard that influenza A is a little bit more severe. And I've never had the flu before, but it's not a fun thing to have. Just put it that way.
Not
So I
fun.
think, from the dates here and the time you're tying from that chart, it kind of makes sense.
Yeah, I'm sorry that that happened. That sounds terrible. And yeah, influenza A is generally more common.
Okay.
And that shows up in our statewide data as well. Yeah,
So thank you for the report.
of course.
Any other questions, comments?
I can add a quick,
Yeah.
the quick note that what we just heard, I just heard yesterday from one of our state assistant secretaries that CDC reached out to him. And because of they cited because of the work that Benton-Franklin did and what happened here, and apparently our contribution to the overall national numbers of avian influenza, they do occasional awards of dollars to support response efforts. And so we are waiting to see, they are waiting to get the contract, but it will come through Department of Health and they will be able to reimburse us for some of the costs associated to that, which has not happened very often. So it's very exciting that that may happen.
That's a good thing.
On the recognition of your efforts and the, around.
Mr. Kyle?
Did you guys get my slides? There's like 50 of them.
Nothing to do with that.
Down on that.
That was last.
All right, so I'm here to request a 1.0 FTE. So BFHD has received an updated contract from Greater Health Now for the Community Care Network scope of work. The updated contract requires an FTE supervisor dedicated to the program and provides the funding for that position. This request is for a 1.0 operations supervisor to support the health services work in the program and connection and alignment opportunities for the community-based workforce throughout the Bi-County area. This is a budget neutral position that would be reevaluated if funding changes.
He sold me on budget neutral.
Both of us, two commissioners, budget neutral is always good.
It's great.
Could you describe though a little bit more about the work that this person's going to be doing? What is the program Greater? So
I cannot.
Yes, I will speak to that. So the Care Connect community health workers, we created positions during COVID as part of the expansion throughout the state to help support the hub concept, which I know you're familiar with, for navigation and connection to healthcare resources. The funding that originally came throughout the COVID response was transitioned to funding through Healthcare Authority. And that was building years or retention years for about 2 years. And then they've continued to utilize a variety of sources through the Medicaid waiver process to come up with more permanent funding. And with that more permanent funding comes more reporting, more requirements, and things that require some supervisory staff time to support our community health workers that actually do the navigation at this time.
I'm just happy.
Yes,
I know. I mean, the contract, because I know you guys have been doing care coordination for a long time. So that's lovely.
That's great. And they're very happy with our work here. It is a regional, every county in the region under Greater Health Now does have some semblance of, we have the most staff with 3. Yakima does have it in multiple different agencies, but ours are all part of the health district. And we are getting a little bit additional money than is allocated for an FTE in general to kind of support that regional and community-based work to collaborate with the other types of community health workers, like at the hospital and some of our law enforcement officers, fire. We have lots of navigators or community-based workers in the community that need to stay aware of each other's work so that we can maximize connection with resources and decrease duplication.
Thank you.
This person would be supervisor for the other 3.
Correct, as well as the community coordination pieces.
Can we get a motion on
I'll
that?
move approval. Back.
I second that.
Here we have a motion and a second. Any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? All right, you guys have it. Election of officer positions. Yay.
You do such a good job.
According to the bylaws, I'll have to go to either Franklin County or a non-elected for the chair position.
Also go Franklin County for a chair now?
Yeah, it just can't be it can't be the same
County.
category.
It can be non-elected or Franklin County.
Yes, and we didn't have that option.
He's not here, we can nominate him,
Why
right?
can't we go Benton County, Benton County? Benton County's done such a good job. I'm just sorry, I might be biased a little bit.
Not elected to throw things into the mix.
What was that?
We're not elected.
What,
Mr. Chairman,
yeah. Lynn,
I nominate Rocky Mullen for chairman of the Board of Health.
I'll second the motion.
There we go. Have a motion and a second for Mr. Rocky Mullen to rock on. Can we, all in favor, say aye?
Aye.
Any opposed? All right, the ayes have it. So now let's do vice chair. Vice chair needs to be Franklin County or elected official.
That I don't remember.
It needs to be opposite. Oh, it needs to be opposite.
So it's Benton
Benton
County
County
or
elected.
or not elected.
Okay, so I'll go ahead and nominate Will McKay as vice chair for as vice chair for the Benton district. We go back and forth, man, so this is, you step up, it's not, you know.
I'll second that motion.
You have a motion and a second. All in favor, say aye.
Aye.
Aye. The ayes have it. Well, I can oppose. Oh, yeah, I can oppose that. All right, the ayes have it. Okay, good, thanks. Any announcements? No announcements? All right. Move on to approval of vouchers.
I'll move to approve the Board of Health approved payments voucher number 90-2024 through 97-2024 in the amount of $1,043,460.58. I did that without my glasses.
We have a second?
I'll second.
I have a motion and a second. All in favor, say aye.
Aye.
Any opposed? All right, moving on to the next one.
Okay, I'll move to approve the Board of Health, to approve the payment of voucher numbers 98-2024 through 101-2024 and 01-2025 through 03-2025 in the amount of $1,087,484.64.
I second that.
I have a motion and a second. All in favor, say aye.
Aye.
Any opposed? All right, you guys have it. Executive session, we have an executive session. Okay. Well, this was a good fast meeting. October 19th. Couple days after Valentine's Day. Put that in the calendar. All right, meeting's adjourned.